Wegovy is now eligible for Part D. And here to talk with me about that is Jae Oh, author of Maximize Your Medicare. Jay, welcome.
Thanks for having me, Bob.
It's a pleasure. Drugs like Wegovy and Ozempic have been in the news a lot, and people are confused about whether Medicare pays for or does not pay for these drugs. Help us.
So, Ozempic has been already approved for coverage, meaning that it had been designated a medication that can treat diabetes and help those people who are diabetics. So, as a result, although the cost is high, notably, it is covered by Part D plans. Now, that has not been the case for Wegovy. Wegovy very recently has newly been approved to treat cardiovascular disease. As a result, it is now eligible to be covered by Part D plans. I would expect that Part D plans will start covering that sometime this calendar year. Obviously, a huge help to those people who want to take Wegovy and still be covered by their Medicare plan.
Right. If a doctor should prescribe this for weight loss as opposed to the indications, does that create a problem?
It does create a problem, Bob, because of the fact that both of the medications that we discussed, and there are other related medications, similar ones, that you cannot take the medications purely for weight loss purposes. Now, it's a very peculiar, difficult to understand relationship since the fact that obesity, for example, has a lot of health related issues, of which diabetes, cardiovascular disease are two. So you do need to be careful that make sure that the doctor is prescribing it for those specific reasons in order to be covered by your Medicare plan.
Right. And then in terms of the coverage, where do these drugs, how are they classified in terms of where they fit on the formularies?
Sure, that will depend definitely on the plan you have. Now, I do expect some complications here because it is not clear as of today's conversation what day your particular Part D plan will include Wegovy. So, as a result, the other complication for the Part D plans is the fact that since the cost is high and since the rules about coverage are known, that in between here, mid year, we don't have a way for the Part D plans to adjust their premiums or cost structures. So the Part D plans will be incurring additional costs as a result of providing the benefit to Medicare beneficiaries.
Right. So in the short term, is it possible that people will have to pay out of pocket for these
For
medications?
Wegovy, yes, that is the case until your Part D plan or Medicare Advantage plan does formally cover Wegovy. And then for that, you may want to contact your Part D plan or Medicare Advantage plan directly in order to see whether or not the coverage has yet begun.
Right. Any other advice or uh, things that people should watch out for as they think about being prescribed these medications?
I do think it's going to continue to be complicated, Bob. It's a point that that we have discussed frequently, which is that the cost of prescriptions continues to be on the forefront of Medicare beneficiaries' minds. I don't think that that will stop anytime soon. And as a result, you'll want to keep up to date on the way that you are charged for particular medications in order to optimize, in order to lower your overall prescription drug costs for sure.
Well, right. And I suppose along with that is to be mindful of which pharmacies you're using for some of these drugs as well.
Absolutely, Bob. That Prescription drug benefits is a very, very complicated combination of your medications as well as the retailer, whether that be your local pharmacy, a national chain pharmacy, mail order. It can very much change the overall financial cost that you would incur based not only on your specific combination, and then everything gets reshuffled every single year.
Right. So one last question, Jay. A lot of people perhaps have seen commercials advising them to use services like GoodRx and other things of that sort. Is that an opportunity for some folks to maybe save some money until until Wegovy gets covered by a Part D plan?
Sure, I get asked that question frequently, whether or not these discount cards do work. The answer is yes. The issue is that there are different tiers and cost structures, meaning that we've discussed, for example, what was the coverage gap in the past, which is now gone. There's the catastrophic stage as well. The issue is that if you use your discount card, that the math, the accounting of your overall cost is not included unless you use your Part D plan or your Medicare Advantage plan.
Yeah. All right, Jay, we've covered a lot of ground per usual. Anything we missed or bears reemphasizing?
I think as a result of these weight loss drugs, as well as their popularity, but yet their high cost, it's something to keep bearing in mind.